Dr. Brian Paris here, teaching you how to be your own Dr. DIY. And now we're going to work with a couple different areas of the head, neck, and face for self-myofascial massage. And myo meaning muscle, fascial meaning the connective tissue underneath. Even though this is physical movement, I want you to bring awareness to what feelings may come up when you're working with these certain areas of your body. Our traumatic experiences, our emotional experiences can get trapped in our body. So you may feel some things come up. Some old memories may pop up when you're working different areas and tissues when you get deeper, more than just range of motion. So the first band we're gonna work on is the neck and the throat here. The muscle that we're gonna work on is called the sternocleidomastoid. So if you can see, when I turn my head, I've got a giant muscle here that attaches to the mastoid portion of my skull, comes down the neck here and goes into the sternum. Now this is a really cool muscle, and the reason is because it's controlled by one of the cranial nerves, and it's very important for several things. One, survival. My fight or flight nervous system, which we've worked on, if I have to run away from a tiger, I'm gonna wanna be able to turn my head as quick as possible. But what happens when I get stuck in this chronic state, these muscles are gonna get constantly overused and overutilized, and they're not gonna have the ability to heal and rest. Some of this work that you're gonna do is gonna help these muscles relax. You gotta give yourself time to chill and heal. I like to use what's called the pincer grasp. We're gonna start by just turning your head. If you're gonna work on the left sternocleidomastoid, the SCM, turn your head to the right. We're just gonna squeeze that muscle. Now, this can bring up some weird feelings, I'm telling you. Just get a nice grip and work up and down this entire muscle. Self-myofascial massage is very different than getting a massage from the outside, right? Because you can talk to someone, tell them, hey, I want more pressure and less pressure. This is a really good experience to embody what's going on inside. So you start to get in touch with your own body. It's gonna help you process some of the chronic pain or even the emotional pain that you may experience on a daily basis. Now, sometimes if you do have a cold or you have chronic immune issues, you have a lot of lymph nodes that are going up and down here, so those may be swollen. So if you are experiencing some kind of illness and that causes pain, I would avoid that at this point. The next one, I like to take my hand, I'm gonna turn the side here. I'm gonna grab my whole neck, big fat grip here. And it's not a squeezing grip, it's just a palm hold. And I'm gonna create a little resistance and turn against that. This just feels so good as I reach all the way down to my trap muscle here. And I'll show you from the front. Even though it's a DIY training, it's not you try to be your own chiropractor and crack your own neck. I'm gonna advise against that. So this is just a simple way just to get this neck and head. I don't want you doing both at the same time either, because you don't wanna cut off your carotid arteries. That's bad news. Next, we're gonna work on the oral band, which is really my mouth and my jaw right across here. What can happen here, and this is pretty interesting, that if you feel like you haven't been able to express yourself, that can be locked up in areas of the throat. It can also be locked up in areas of the oral band in the face. You may have biting issues where your jaw may not be aligned properly. What's really important to understand is that any jaw issues are intimately related to the upper cervical spine. So my occiput, which is the highest bone in my cervical spine, and the top bone, the atlas and the axis, so the top three areas of the spine, intimately related to the jaw. Those areas are specifically in charge of head and neck rotation. So if I have issues with that head and neck rotation, even working on the jaw and the oral band may loosen this up a bit. So simple enough, you can open your jaw and relax the mouth here a little bit and start to work into, you'll feel if you open the jaw here, you can feel where this actual joint, the jaw goes into the skull here and opens up, and you can start massaging there and you'll feel some real tightness, and you follow the line of the jaw. This can be pretty painful, especially working on yourself, but it's like trying to tickle yourself is hard. So you don't want to push, you're not gonna be able to push past that level of pain, but you do want to work into the muscles. You can use the tips of your fingers here in a circular fashion or in a linear fashion, and then work all along the line of the jaw here, even in the chin and around the top of the mouth here, all on these areas. You'll find this just feels so good. Now, your chewing muscles also come up into the side of the skull, so you can work into the temples here with a circular movement and using the finger pads here into the side of the skull. where these are in charge of chewing and speaking. Lastly, in this band, I like to work on the ears. So you can actually just squeeze your ears. You can stretch on them a little bit. And sometimes you may even get a little pop in the ears, and that's okay. Again, if you do have ear infections, things like that, I would avoid doing those at that point. Now we're gonna work on what's called the ocular band. This is my favorite because I'm using my eyes. We're all using our eyes all the time to see the world, and especially working on the computer on a consistent basis. So glasses off. And we're gonna work on this band here, really my eyes and the top of the skull. I'm gonna start in the middle of my forehead and really just open those tissues up. If you do have oily skin, it's helpful, or you can put some lotion on. Really get a nice stretch in that front area. I'm gonna suggest to close your eyes when you're doing this, end with the temples, and get a nice massage here. And think about this, every 10 to 15 minutes, if you were to just start to loosen your eyes up, it's gonna help with vision, it's gonna help with headaches, it's gonna help with your ability to think clearly as well. So right where my eyebrows are, and then below we have our eye sockets. So you can use the thumbs, you can hold in one spot if you find some tissues that are tense, and just hold it there. Nice easy breath through the belly. Don't push past pain. And I'm gonna run all along the ridge here and even get a stretch at the end. It feels so good, and I can work into the temples again as I finish. Good, and then the next one, I'm gonna use my pointer fingers here, start at the nose, work my way down along the lower orbital ridge. I can find some areas of tension and hold that. Stretch at the outer side of the ridge. Again, finish with the temple. Now, we talked about the occiput and the atlas and the axis, the top of the spine, and control of rotation. So a lot of us will find a lot of tension in the top of the skull here. So the thumbs become a good tool here. Imagine that you're reaching underneath the skull. My fingers are on the top portion here, and I can stretch a little forward in this area. And really just, I'm imagining that I'm lifting the skull up off of these tissues, almost like I'm opening the hood of a car or the trunk of a car with my thumbs, and working in the center all the way out along this ridge. And you can add in some neck stretches. Take the rest of the fingers here and you can massage the rest of the skull here. So there you have it, with some great techniques to be able to use, especially for those of you who are on the computer all the time, driving all the time. I mean, these are just ways to, again, embody a healthy way of living, to get in touch with what's going on so you can live a long, healthy life with less pain.